I'm Dr. Thanuki, and as I mentioned before, we were going to discuss the medical benefits of exercise and ways in which you can prevent and control non-communicable diseases with exercise and lifestyle. And I decided to start with diabetes because it's a worldwide epidemic. So over 422 million people worldwide are diagnosed with diabetes. In Sri Lanka, about 1.1 million, which means the prevalence in Sri Lanka is about 8.5%. That means 1 in every 12 persons have diabetes. And there are millions and millions of cases worldwide where they don't know they have it and they are not diagnosed. And millions of cases of diabetes related complications leading to death, and also because of high blood sugar. So there are several types of diabetes. There's pre-diabetes, there's type 1 diabetes, type 2 diabetes, and gestational diabetes. So type 1 diabetes accounts for about 5 to 10% of the cases of diabetes, and is an autoimmune disease. And usually it is diagnosed quite early in life and used to be called juvenile onset diabetes. And the symptoms are occurring quite suddenly, and marked feature of this is diabetic ketoacidosis episodes, which are life-threatening. There is no treatment currently apart from administration of insulin, because your body is insulin deficient in type 1 diabetes. So type 2 diabetes account for majority of cases of diabetes, that is about 90 to 95%, and it used to be called adult onset diabetes because it was found in young adults mostly. Up until recently, now more and more children are diagnosed with it. So obesity and physical inactivity are largely associated with type 2 diabetes, and the symptoms are usually less marked and happen gradually compared to type 1. So people who have the disease have had it for several years before they are actually diagnosed with it. And positive family history is usually associated with this condition. 2 diabetes can be controlled by lifestyle modification, diet, and exercise and medication, because it happens due to our body's insensitivity to insulin. So both type 1 and 2 diabetes have similar symptoms except for ketoacidosis, including excessive excretion of urine, which is polyuria, excessive thirst, which is polydipsia, and excessive hunger and eating, polyphagia, weight loss, fatigue, vision changes, and many more other complications. So gestational diabetes is not diagnosed through symptoms, but only through prenatal screening, and that is usually between 24 to 28 weeks of pregnancy. And they are at risk for developing diabetes later on in life, at like a 7 times increased risk of having type 2 diabetes later in life. And even during pregnancy and at delivery, more prone for complications like preeclampsia, maternal gestational hypertension, and C-section deliveries. And the children that they give birth to are also more likely to develop diabetes type 2 later on in life. So impaired glucose tolerance, or being pre-diabetic, it's leading to developing diabetes later on in life, but it's not inevitable. You can control it through lifestyle and dietary modification. And this is a criteria for metabolic syndrome, which is a constellation of symptoms that has really bad consequences, and we'll be discussing this later. So diabetes is diagnosed in several ways through blood testing. HbA1c of more than 6.5, which is glycosylated hemoglobin A1c, and a fasting blood sugar of more than 126 milligrams per deciliter, or a random blood sugar of more than 200 milligrams per deciliter, or an oral glucose tolerance test of the same amount is diagnostic of diabetes. And pre-diabetes is considered fasting blood sugar, which is between 100 to 126 milligrams per deciliter. So when talking about complications of diabetes, the longer you had diabetes for and the longer it's been uncontrolled for, the higher the risk of complications. Diabetes related complications include, but are not limited to, heart disease, including stroke, hypertension, nephropathy, which is kidney damage, retinopathy, which is eye damage, and neuropathy, which is nerve damage. And diabetic nerve damage Nerve disease cause a majority of the lower extremity amputations, non-traumatic amputations of people. So the treatment of diabetes for type 1 diabetes is insulin, and for type 2 diabetes is there are a variety of drugs that increase the sensitivity of insulin, secretion of insulin, and decrease the production of glucose as well. But the most important thing when considering exercise as therapy is to be cautious of which drugs cause hypoglycemia or low blood sugar, which is medical, which requires intervention right away. So type 1 diabetes is treated with insulin. Type 2 diabetes with a variety of drugs are available for treatment. But the important thing is to understand which drug causes low blood sugar or hypoglycemia, which needs immediate intervention, and especially during exercise it's very important to watch out for low blood sugar or hypoglycemia.